Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's up, Mitches? Not to be confused with the B word, as you know, I personally would never use that kind of language. Anyway, this is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to personally welcome you to episode 22 of the Ask Dr. Angela podcast. Let me just say that fall is finally in the air, especially after what seems like an entire week of downpour. Torrential showers, we are talking rain and flooding, like in a biblical sense. Hurricane Joaquin, luckily, did not hit landfall here out east. So grateful for that. And today was a really beautiful, beautiful, beautiful fall day. I'm just really actually very grateful that I can now walk up and down my stairs and even sit down without almost dying. I've been doing these workouts and having these personal training sessions, fitness and health. Again, here in my house, we do more than talk the talk, we walk the walk. I do believe in leading by example, but I've just got to tell you that last week just kicked my tuchus, so to speak. I said to my trainer, this was clearly, during one of the sessions last week, this was clearly the hardest workout of my entire life. And he's like, oh, I remember that day and that workout that you're talking about. You mean the one where you were laying on the floor and you could barely get up and you looked like you were going to throw up? Oh, yeah. So anyway, my legs were so sore this Friday past, there was no way that I could walk down the stairs without bending my legs. So I just laid down on the steps and slid down. Needless to say, I had carpet burn on my back and my clothes got really wrinkled, but nevertheless, I did make it downstairs and was able to make it to work on time. But anyway, enough of my adventures of working out. And again, I'm really happy to tell you that I'm, moving and grooving again. But let's jump into today's question coming to us all the way from Denver, Colorado. What you got for us, Kristen?
Hi, Dr. Angela. This is Kristen from Denver, Colorado. If a woman has a large fibroid, would you recommend her getting it removed prior to getting pregnant?
First of all, Kristen, this is an excellent question. People, what I want to say to you is that Kristen actually submitted this question to me via email at askdrangela.com. And I was so impressed with this question that I asked her to submit this for the podcast because this is a question that lots of women I thought would want to know my response to. So Kristen, I was so moved by your question that last week's blog post actually was dedicated to fibroids, what they are, how they affect women, management, the whole nine. So in response to your question and whether or not you should have a fibroid removed prior to getting pregnant, the way that I'm going to respond to that is as follows. Number one, it depends on where the fibroid is located. Certainly fibroids don't necessarily have to be symptomatic. What we do know about fibroids is that they are benign tumors most of the time. What happens with fibroids is that the smooth muscle cells of the uterus become hyperplastic or they just grow. And fibroids can range anywhere from the size of a pea to the size of a cantaloupe. I actually removed a uterus not so long ago that weighed 30 pounds and it was a fibroid uterus. I was like, oh my gosh. It was huge. And surprisingly enough, this woman that had this fibroid uterus was completely asymptomatic. And what I mean by that is she wasn't complaining of some of the things that we know are characteristic when you have fibroids: pelvic pressure, heavy periods, painful periods, sometimes bowel or bladder issues, whether it be constipation or feeling a lot of urgency because you've got a huge fibroid that's constantly pressing on your bladder. You can have, again, a fibroid and be completely asymptomatic. A lot of times women will discover that they have a fibroid based on an exam in the GYN office, where your gynecologist does the pelvic exam and says, oh, your uterus, seems a little bit enlarged to me, or I think I might feel something, and then we order an ultrasound, and then boom, oh, you've got fibroids. That's what we're feeling. So you can have fibroids be completely asymptomatic and be fine. You can have fibroids during the course of a pregnancy and be completely fine. The issue with fibroids and getting pregnant can sometimes be a little bit tricky. And my general rule of thumb is this: as long as the fibroid does not encroach upon the lining of the uterus, or what we call the endometrium, I don't typically recommend removing it. Now, certainly if the fibroid is impinging on the lining, you may have some difficulties either conceiving or sometimes increased risk of miscarriage secondary to implantation issues. But as long as the fibroid doesn't encroach or infringe upon the lining of the uterus, I typically leave them alone. I have tons of pregnant women that have fibroids and are pregnant and are not having any issues. The other thing that we commonly will do when women have fibroids and are pregnant is, we do growth ultrasounds on the baby just to make sure that baby is growing appropriately, as sometimes fibroids, if they get to be too large, can kind of hinder growth of baby. The other thing with fibroids in pregnancy is that sometimes fibroids can become very painful during the course of a pregnancy due to redistribution of blood supply, and that can cause fibroids to degenerate or die off. So, Kristen, I know I've gone on and on and on, but I think that the two biggest things to consider before removing a fibroid in hopes of getting pregnant is the location and the size. And again, if the fibroid isn't anywhere near the lining of your uterus, I probably would just keep an eye on it. And for me, keeping an eye on it is typically we monitor women with fibroids in my office, or I personally monitor women with fibroids annually, or sometimes every 6 months, just to make sure that they are not growing at an exponential rate, because certainly if they were getting too big too soon, that might raise my eyebrows for something more significant, something like a leiomyosarcoma, which is malignant, but again, fibroids are benign like 99% of the time. Kristen, thank you so much for asking this question. Again, it was an excellent question, so excellent, in fact, that I featured a blog post on fibroids because I was so moved by your question. So, because we used your question on the Ask Dr. Angela podcast, someone from my team will be reaching out to you to gather your information so that we can send you one of our bomb-ass t-shirts. And for those of you who would like to have a question featured on the podcast, please go to www.askdrangela.com. Click on the microphone on the right-hand side of the page and do what you do. I would also encourage you to check out and sign up for my weekly blog that comes out every Wednesday. It is the Say What blog on the same webpage, www.askdrangela.com, and just click on the Say What blog. There's just a ton of really helpful information, and it's just me being my usual kind of straight to the point, dry humor kind of self, but I think that you get a lot out of it. And again, the blog posts are entirely women, patient, people-driven. So everything that I write about has to do with something that someone has asked me or that, I've recently talked about with someone in general conversation. In closing, I'd like to leave you with this. There is only one way to avoid criticism. Do nothing, say nothing, be nothing. So I'm challenging you to do something, say something, and be something. Until next time, look better, feel better, be better. Can't wait to connect on episode 23.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.